Registration and International Information Transmission, and also the Registrar and Executive Director, and also the General Secretary of the Informatics Society of Nigeria. So the institute currently has over 100 members across 4 countries in Africa, office in Abuja and training in Dubai.
Sorry, I don't know if I'm a bit deaf, but I can't really hear you, Williams. Could you kindly speak up a little bit?
Okay. So we, African Digital Research Institute was established around 2020 when the COVID-19 problem. I think COVID-19 seriously ravaged Africa and it took us by surprise. As a result, we came together with International Federation of Health Information Management Association, African Region, the University of Dubai, and the Computer Science Department, and also Health and Informatics Society of Nigeria to form African Research Institute. So the problems we've been encountering in Africa is been majorly paper-based systems, public hospitals, clinics, access to public data, isolated networks, and lack of accurate data. To see our people, they take advantage of the Western world because they, for example, you know about Gates Foundation have been trying to pump money to Africa to eradicate polio. But every year, our people, they don't want polio to go because they believe that every year they need money in their pocket. So the accurate data has not been there. It's one of the problems we have here. So as a result of that, there have been problems to database, no records, no planning, no access, and definitely no life. So it has been problems to us in this part of the world. So what do we do? Ours is digital and solutions, healthcare technologies, education and training, and research. So digital is all about education exchange, interoperability and standard, healthcare applications and simulation, quality improvement through health IT and dry laboratory. So our focus on the next 5 years is about awareness programs for students and professionals for starting a career in health informatics. I will tell you why. 2 years ago, I was at a clinic called Don Bosco by Italian government. So in Don Bosco Medical Center, I told them about health informatics and medical informatics. They said, my grammar is too much. Now, what are you talking about? They've not heard about, you know, a whole medical doctor not hearing about health or medical informatics is a lot of embarrassment. So we have been going about telling people, telling health organization and medical health organization and even higher institutions about how they can adopt, you know, EHR and health informatics as a course in most of the organizations in Africa, especially university institutions. So that be one of us. Then developing a curriculum in health informatics that is bespoke to African context. For example, John have been telling about NHS. You don't have NHS over there. You don't have, you know, a policy or whatever. And just in India too. The Indians have been coming. They have already gotten a suite of their package that is not even in our context. So we want the local one that is, and this is why where CTHR comes in, because it's adaptable, it's flexible, and it's accessible. Unlike those ones that are expensive that we cannot afford, you know. So that is why we are adopting CTHR. Then annual events across Africa promoting the adoption and implementation of CTHR. Imagine having people like this in Africa every year. It will be a lovely and a wonderful experience for us, and that will be a very unique, you know, something for us. So what are we saying? It has been an opportunity, a blessing in disguise for us to have associated with 7 informatics. 7 informatics and Kodam University. about the platform of ADHRI. So we are very, very lucky to have even met you, and it will be something that we need to repeat in Africa, telling people about what we have gone through in Africa, and they'll be looking forward to even see ADHRI being adopted on the platform of health informatics.
Thank you.
Thank you.